With all the different rules surrounding Social Security and Medicare, sometimes it can be a little bit confusing to know how they can work together. We had a really good question come in from one of our listeners wanting a little bit more clarity on exactly how they work together. And if you start Social Security, does Medicare start automatically? This question came in from Richard, and he said, I'm trying to understand how Social Security and Medicare actually work together. If I start drawing from Social Security, does Medicare automatically kick in? And how does the timing affect my coverage or premiums? I just want to make sure I don't miss anything important. So for me to help best answer this question, I wanted to provide a little bit more clarity on when you can claim Social Security and then when you can claim for Medicare. Under current law, age 62 is the soonest that you can start your Social Security. This would be claiming early. Unless you're a widow or widower or have Social Security benefits, then the answer is going to be a little bit different. But for most people, claiming Social Security would be starting at age 62, and you can delay it all the way up until age 70. So in this example, I don't know Richard's age, but let's say he turned his Social Security on at 62. You won't be able to start your Medicare until 65. 65 would be the soonest that you could turn on Medicare Parts A and B. And so you would, in this case, turn on Social Security. You wouldn't pay for Medicare. And then starting at 65, you would sign up for Medicare A and B, and then start paying for Medicare 3 years later at 65. And it's true that Medicare is billed under your Social Security. So it's a deduction from your Social Security payments that you would start to receive once you turn on your Medicare benefits. When it comes to Medicare, you can delay signing up for Part B if you're still working and are covered under yours or your spouse's employer's health insurance plan. So for federal employees, that would be the FEHB. For a lot of you, it might be a Blue Cross Blue Shield plan. So let's say at 65, you're still working under the federal government. You would sign up for Medicare Part A, which is the hospital part of Medicare. There isn't a premium for paying for this when you sign up for Part A, but you would sign up for it at 65. But let's say you were still working, and let's say you retired at 67, later past 65. You don't have to sign up for Medicare Part B until 8 months after you've separated from service and are no longer covered under your employer's health insurance plan. So if you're looking at retiring again after 65, you have an 8-month window to sign up for Medicare the date that you retire. So to answer Richard's question, when you sign up for Social Security, it depends on if you're still working and are covered under an employer plan or if you're under the age of 65. In that case, no, Medicare wouldn't automatically kick in. You will sign up for it at 65 for Part A, and you could possibly delay Part B if you're still working covered under that FEHB plan. You probably wouldn't want to turn on your Social Security sooner than your full retirement age, which for most people, somewhere around 66 or 67. And if you're still working, because of that earnings limit test that says if you make somewhere over around $22,000, $22,000 or $23,000, that number goes up every year, then your Social Security benefits would get reduced. So if you're still working, probably don't want to turn on your Social Security until you're done working, so that you don't have that earnings limit reducing your Social Security. But again, just signing up for Social Security does not automatically enroll you into Medicare. There is a penalty if you don't sign up on time. So there's a normal enrollment period for Medicare. When you turn 65, you have a 7-month window to sign up for it. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. That's the normal enrollment period. So assuming that you're retired and you're going to sign up for it, this is when you would sign up. And you could choose at that point to turn on Social Security. You could choose to continue to delay it, but this would allow you to turn on your Medicare Part B premiums and not have a penalty. That penalty is 10% per year, every year that you don't sign up on time. So if you turn 65 and you didn't sign up for Part B, a year later you turned it on, your premiums would have a 10% permanent penalty to them. Or even worse, if you waited until 70, that would be 5 years. So a 50% premium increase for signing up for Medicare Part B if you chose to delay that. Again, I mentioned an 8-month window a little bit earlier. That applies if you're working and are covered under yours or your spouse's employer health insurance plan. You have an 8-month window from the date of your retirement or your spouse's retirement to sign up for Medicare Part B and not experience that penalty, even if you're over the age of 65. So let's say you or your spouse work to 67, you choose to, let's say you retired and you're at 67, you have 8 months to sign up for Medicare Part B. Otherwise, that 10% per year penalty would apply again for you if you were to sign up late. So hopefully this provides a little bit more clarity. This stuff can get a little bit confusing, so feel free to leave more questions or comments below in the comment section. Make sure you are subscribed to our channel, and that way you can get more videos and content related to this subject. And of course, until next time, happy planning.